Hi, Dr. Susan here. I wanted to talk a little bit more about labiaplasty and get into detail about exactly how it's done so that you know what to expect. First of all, when you come to see me in the office requesting a reduction labiaplasty of the labia minora, which is what we're going to talk about today, those inner folds of skin that can sometimes protrude longer than we want to, they can be asymmetric or sometimes be dark around the edges. How is that surgery done? Well, first of all, I'm going to spend an hour talking to you about it. We're going to look at pictures. We're going to take pictures of your anatomy, do some markings, make sure you fully understand and we agree on exactly what you want so that I can achieve exactly what you want, because everybody's different and this can be customized to suit what you desire. Secondly, we'll schedule the surgery. It's done at MD Aesthetic Surgery Center, which is actually right in my building at 1200 Benz in the medical center. It's a beautiful cosmetic surgery center. I've actually had surgery there myself. Very, very safe, best anesthesiologists. So on the morning of surgery, you arrive, you're very comfortable. We give you something to help you to relax. The surgery takes about an hour and a half. Of course, during that time, you're sleeping peacefully, not feeling anything. During that time, I measure and mark meticulously. The secret about me is that I grew up sewing clothes. So it's very much like sewing clothing. You know, we want to mark and measure everything perfectly to make sure that we create a custom fit for you. So about the first 30 minutes, believe it or not, is just measuring and marking, placing tacking sutures to make sure that those planes of tissue don't move. Because the worst thing that we can do is create asymmetry or cause too much skin to be removed, which cannot be put back. So I put on my little needlepoint glasses. I also did needlepoint, crochet, knitting. All of this led to being a pretty good surgeon, I think. So once everything's marked and measured, then those edges are cut to your previously specified wishes. Now I happen to use just an electrocautery tool, but we can use laser. Other doctors use other cutting devices. You know what? It really doesn't much matter what we use to cut the skin, but that extra skin is cut. And then those edges are meticulously sewn together. Now I use a very meticulous sewing technique that, like I said, I learned growing up sewing clothing. Not unlike that at all. Very tiny suture, little tiny magnifying glasses, making sure everything's perfect. And all those stitches dissolve. So because there's a lot of stitches, we don't want you to have to come back and have them taken out. They dissolve in about 2 weeks. Now, once I've achieved the perfect result and ensured that it's symmetrical, of course, that it's not bleeding, before you wake up, I use a very good local anesthetic block. It's actually called a pudendal block, and back in the old days before epidurals were so popular, we actually used to use that for childbirth because it makes your whole bottom area numb for about 12 hours, which is great because you wake up feeling completely comfortable. It gets a little more uncomfortable when that wears off about 12 hours later, but by then you've got home, you're able to be comfy in your own bed, use an ice pack. So 2 or 3 days of just relaxing at home using ice off and on, a little bit of pain medicine. Usually by the 3rd day, you're able to be up and about. I recommend taking about a week off work unless you can work from home with your feet up, which many of us can nowadays. 2 weeks, you're back to being able to do most moderate exercise. And then 4 to 6 weeks, you can be going to spin class, having intercourse, back to your full activities. I always tell people it does look a little swollen for about 6 weeks. So we don't expect the perfect result for 6 weeks, but that's about how a labiaplasty goes. Short recovery, we're in contact regularly to make sure that you're okay, and you'll be in great hands and have the most beautiful result that you'll be happy with for the rest of your life.